Hello dear viewers and welcome back again, and we have our second guest right here, but before that, a small info. A healthy smile is about much more than an appearance and reflects confidence, well-being, and overall oral health. Advances in modern dentistry have made it possible not only to restore damaged or missing teeth, but also to enhance smile with highly personalized and natural-looking results. Now, from dental implants and complex restorations to the latest innovation in aesthetic dentistry, today's treatments are transforming the way patients experience dental care and improving their quality of life. To help us better understand the science behind smile restoration and the growing role of cosmetic dentistry, we are delighted to welcome Dr. Tamara, a prosthodontist and aesthetic dentist. Dr. Tamara is specialized in that. Okay, it's such a mouthful to say it.
Yes, it is. Prosthodontist.
Prosthodontist. Okay.
Yes.
Now, talking about that, Dr. Tamara, since you're specialized in that, we want to ask you, like, prosthodontics, is it often described as the art of science of restoring smiles? And could you explain the prosthodontics involves and how it differs from general dentistry?
Yeah, sure. أول إشي مرحبا.
Okay.
السلام عليكم.
Salam.
Prosthodontics actually is the specialty of restoring and replacing missing and damaged teeth while also maintaining function and aesthetics. General dentistry has a wide array of treatments, but prosthodontics focuses on more complex treatments such as crowns, bridges, implants, as well as full mouth rehabilitations, restoration of worn dentitions. So in general, it focuses on the whole chewing system rather than a simple procedure or a direct procedure.
All right. So in the line of dentistry, or in the line of the procedure of fixing somebody's teeth, where does it lie exactly, being a prosthodontist?
Well, a prosthodontist is first of all the person or the specialty responsible of treatment planning.
Okay.
A treatment plan should be individualized to each person, and it should be, of course, backed up by science. So this is where the prosthodontic comes. He actually draws the map for the treatment, for any treatment that's done for the patient. Of course, we are not a one-man show. We are depending on a team, on a team play, and we are depending a lot on the surgeons, on the endodontists, on the general dentist, as well as the orthodontist. It is a teamwork.
Yeah.
But eventually, prosthodontics, because it is more generalized and it is more focused on the whole system, usually puts the treatment plan.
All right. So basically, you do the mapping of the teeth, you do the planning of the patient to know exactly what the patient needs, whether it's an implant or just a cosmetic fix or replacement and all that, or maybe a root canal. And from there, the patient can take his or her first step into the treatment.
Indeed.
All right. So in recent years, aesthetic dentistry has become increasingly popular. So how do you balance cosmetic improvements with maintaining long-term oral health?
Okay, a beautiful smile should never come at the expense of health.
Of course.
Of course. So when we are making a treatment plan or an aesthetic treatment plan, we should be focusing first of all on the health of the oral environment. Any plan should include preservation of tooth structure. It should include preservation of gum health, and eventually it should also provide the patient with something that's functional and also long term. So it's not just longevity and functionality is just as important as appearance and cosmetics.
Of course. I mean, you need to have a strong teeth to keep that smile for long.
Indeed.
And healthy. And also, as I always know, and this is what my doctor says, like keeping your oral healthy will also keep your digestive tract healthy, your gastritic healthy, and so on. And it will also help with your immune system.
Of course, the human body is a system. It's a whole system. It's interconnected, and we cannot treat the mouth in separation from the whole system.
That's very true.
Yeah.
Now, dental implants have transformed restorative dentistry. So what factors determine whether a patient is a good candidate for implant treatment?
Well, there's a lot of factors that we need to take into consideration. First of all, the general health of the patient.
Of course.
The gum health, the oral hygiene for the patient. We should also see the bone quality and quantity for the patient. Their bite, But with the advances in implant dentistry and bone grafting procedures, we have included a lot of patients, and we usually say there is no absolute contraindication to implant dentistry. But at the end, proper diagnosis and treatment planning is the basis for any successful implant treatment.
All right. I mean, I have one of my teeth. I actually did an implant because it got broken in one time, and the doctor always told me like you're a good candidate, but you still need to just do a little bit of a bone graft because it's just because you took a lot of time to actually fix it. So you need to do a bone graft from the beginning, and then after that we can do our plan. And it took a good 3 months until they actually made sure that the bone is in the right density, the implant is in the right place, and that it doesn't disturb the gum.
One thing we always tell our patients is that the option that you have today, you don't have it tomorrow.
Oh, yeah.
Because bone is dynamic, and the longer you stay without your tooth, the bone is going to keep resorbing and resorbing.
Yes, exactly.
So usually there is bone grafting procedures, of course, but the sooner that you take things into action, the easier the treatment is going to be.
The better you use your natural bone than actually bone grafting. Even though bone grafting is very good, it's not a bad thing. It actually grows your bone.
In a sense.
So many people seek a perfect smile. Hollywood smile, as they call it. But beauty can be subjective from a professional perspective. What elements define a natural and aesthetically pleasing smile?
Okay, a lot goes into that question.
Yeah.
Unfortunately, a lot goes into like what's trendy into that question. But more and more people are now seeking natural smiles. Now, as a rule of thumb, any aesthetic transformation should draw compliments to the person rather than to the dentistry. The dentistry done. Okay, so before planning to do this aesthetic treatment for the patient, we should also always look at his facial features, his lip dynamics, giving him the proper shade of teeth, giving him the proper dynamic within the tooth itself, within the aesthetic treatment itself. And aesthetic is not just it's not just a beautiful smile. Sometimes aesthetics is just regaining health for the patient, for the patient's oral conditions.
It's true, because sometimes some people that have a perfect smile, everything is okay, but they just want to push it a little bit more, make it brighter, make it more straight, but they don't know that actually can affect the way that you might talk, the way that you might bite even. So it can also fix, reshape the structure of your jaw and maybe a little bit of your face. You kind of look a bit different. And it's a 50-50 chance. You don't know if it actually could make it better, or not worse, but maybe to make it a little bit different.
That's where treatment planning. That's where treatment planning comes into place.
Exactly.
Again, because treatment planning, we should put a balance between what we can give to the patient and what we will take away from him. We should always add benefits. It should always add value to the patient, whatever treatment we do, especially aesthetics. Because as you said, it might take away something more valuable than just the appearance for the patient.
That's very true. Now, digital technology is rapidly increasing and changing dental care. So how are innovations such as digital smile design, 3D imaging, CAD, CAM technology improving patient outcomes? Digital dentistry now, digital technology is in every aspect of dentistry. It is in the diagnosis, the treatment planning, the procedure itself. So it has been integrated in every aspect of dentistry. The best part about digital dentistry, in my opinion, is dentist-patient communication. Okay, it has improved the communication with the patients, because you asked about smile design. Smile design can actually show the patient the end result, the final result of what we are offering him, without even touching his teeth. So we can communicate more if this is what he wants, if it's up to his expectations. So it's like a tool that we can actually show the patient on picture, with a picture, what the outcome will be. And if we agree on that, we can go back to ground zero and then build up from there. Start the procedure from there. All right. Now, what are some of the most common misconceptions patients have about veneer, crowns, and other cosmetic dental procedures?
Well, maybe the major misconception is that veneers is for everyone.
Okay.
Definitely, veneer is not just like a one fix for every problem. Another misconception is that people think that cosmetic dentistry is just about veneers. Cosmetic dentistry can be about orthodontics, can be about bonding, can be about I said orthodontics, maybe whitening. So in general, there's a lot of aspects that we can improve the aesthetics for the patient. It's not just going for veneers.
Yes, I know veneers is kind of like a background droplet in the front. They just like put it there to keep whatever what was there in the background. And it's true, it's not for everyone. I mean, in the end of the day, well, you can't say anything because in the end of the day, it's the patient's wanting. I mean, that's what they want. Even though if you do advise them, sometimes they want to push it.
True, but this is where the responsibility of the dentist comes.
Yeah.
The dentist should not just advise, she should guide the patient to the best treatment option for that patient. It should be the treatment plan should be individualized to that patient. So it's not what the patient wants, because sometimes the patient wants now, but we always should carry the patient to himself in the future. Yeah. Because if you choose this now, in the future you're going to suffer from this and that. Yeah. And this is where the responsibility of the dentist comes. He should not just provide veneers left and right.
Yeah, just left and right. It has to be a process of awareness and showing the dangers or the future outcomes.
True.
Also.
True.
So what are some, beyond the aesthetics, how can restoring missing or damaged teeth impact a person's confidence and quality of life?
This is actually scientifically proven. Of course, it has a huge impact. It has a huge impact on the psychology of the patient, on the self-esteem of the patient, on the quality of life, whether it's the professional life or the personal life. Having a nice smile, having a healthy smile, always have an advantage on the patient well-being in general.
All right. Now, finally, what advice would you give to our viewers who are considering cosmetic or restorative dental treatment to ensure that they make informed and healthy decisions?
Well, always seek comprehensive treatment. Never go for a specific problem. Always ask your dentist for a comprehensive treatment plan, for something that solves the whole system, so that you don't keep like stitching here and there. Yeah. Second of all, choose a dentist that prioritizes health and function. Because again, as I say, each treatment plan should be based on the individual, on what's best for that patient. And it should be scientifically based. Every treatment plan should be scientifically based. But eventually, what really matters is the health, the functionality, and the longevity of the treatment that the dentist is going to give you. So choose a dentist that actually prioritizes those things.
So you're trying to say is that always prioritize your health over anything, making sure that you find the right dentist. At the same time, it's okay to ask different opinions and compare between different doctors and different clinics and all of that. Once you narrow down the clinic and the dentist, then after that we do, as you said, the mapping and finding out the right plan to proceed with such basically procedures.
Don't always go for a dentist. Like some dentists, unfortunately, jump to aesthetic fixes, like quick fixes. Yeah.
As you said, stitches here and there.
Yes, exactly. Again, just go for somebody who actually prioritizes health, functionality, and again, the long-term treatment, the long-term.
All right. Thank you so much, Doctor, for being here with us on Good Morning Kuwait.
It was my pleasure.
It was actually our pleasure for you to be here and giving such an informative information. And I hope our dear viewers will actually take this with them and actually find the right health plan for their oral health.
I hope so too.
Thank you so much.
Thank you so much for having me.
So all thanks and appreciation to our guest, Dr. Tamara, a prosthodontist and aesthetic dentist. Now with that, how about that we take a short break and we'll be back for more right here at Good Morning Kuwait. So stay tuned and don't change the channel.